So today we're looking at 10 mistakes that people make that actually destroy their weight loss journey, or they prevent them from losing weight. Number one is only cardio and no weight training. The problem with this is the cardio, well, it's good for your heart and for your vascular system. You also need to do cardio, but if you do not add weight training or resistance training to it, you are actually burning no calories or very few calories outside the gym. In the gym, you might be thinking, well, I just ran about 16 miles, or I just burned about 1200 calories on the Stairmaster, but I'm not losing weight. You're not losing weight because you are actually getting more hungrier, you're eating more in return, and you are not burning any calories outside the gym. The calories burnt outside the gym repairing your body, your muscles, are actually the calories that count. If you add resistance training to your workouts, you would actually be burning many more calories outside the gym, because once you lift some weights, your muscles actually stretch and they produce these micro tears inside the muscle filaments, in the microfilaments. And when you go home, when you're in your recovery period, your muscles, they actually repair themselves and they remake those fibers. Due to this, there is a lot of ATP and a lot of calorie deficit. Those are spent for your repair. You also need much more protein, and you have a higher thermogenic or calorie burning index. So please add about 20 to 25 minutes of weight training to your existing cardio routine, and that would help you a lot. Number two is you believe in these weight loss teas. So you might have seen a commercial, or you might have known a friend who just bought a weight loss tea, or a jasmine tea, or some fancy green tea that's about $80 a box. Now, those weight loss teas do less or really nothing to your weight loss journey, and that's because most of these weight loss teas are actually diuretics. So they will actually drain a lot of fluid from your body. They will actually make you think you're losing weight while you are actually losing water and you're actually getting dehydrated. They will actually pose more danger than benefit to your health. So think twice before buying these weight loss tea or these weight loss supplements. So sometimes these supplements, they are just out there to target you, or to just make you buy them and not use them at all. Or sometimes even if you use them, they're actually making you lose water. Now, if you lose more fluid, guess what? You'll be dehydrated. You'll have a higher chance of kidney disease. You'll have a higher chance of getting stones, more health and fitness issues like easier tiring, like you'd get exhausted easier, or muscle cramping. Think twice before buying these magical weight loss teas that will make you lose 13 pounds in just 10 days. The third mistake is you're going on a calorie deficit, but you're not actually reducing your carbohydrate intake. What's more important than reducing your calories is reducing your total amount of carbs. Now, carbs actually determine your hunger factor. If you eat a lot of carbs, you release a lot of insulin, and you actually get those spikes in your blood sugar levels. If you get those spikes in your blood sugar levels and you get a lot of spikes in your insulin, you are actually storing more fat. You're not burning it. So guess what? You're hungry all the time. And if you eat more protein or more fat, you would actually be less hungrier, because it releases a lot less insulin and it makes you feel much more fuller and satiety. It gives you that satiety factor because they release these special hormones in your gut that actually send a signal to your brain or to your hypothalamus, to the lateral part of the hypothalamus, that this person is not hungry. After all, it's a game of hunger and satiety. If satiety wins, you lose your weight. If hunger wins, you actually end up gaining. And I've seen a lot of patients that have gone on calorie restriction diets, and once they end those calorie restriction diets, they end up gaining more weight, even 10 pounds more than what they started with. So the fourth mistake that people make is that they go on crash diets. They don't eat anything at all, or they just drink simple water. And these diets are really, really harmful for your body. Your body has these essential amino acids, these electrolytes, these micronutrients that your body actually needs to sustain and to function properly. If you are just drinking water, just plain water, you are depleting those electrolytes. You are depleting those micronutrients, sometimes essential ones. You're depleting these essential amino acids. You're depleting many, many other important chemicals in your body that you need to function properly. And There's a term that when these people that go on prolonged fasts, like crash diets, and they suddenly break their diet and eat carbs, or they have a meal, a large meal, they actually go into refeeding syndrome. Now, if you search refeeding syndrome, it's actually due to a decrease in those phosphate levels. Now, because you're eating a lot of these carbs at the same time, your body needs to generate more ATP. Now, ATP is a currency of power, and the phosphate that's actually in the adenosine triphosphate molecule, it depletes in your body, and they actually go into comas, and people die due to this refeeding syndrome. And people actually come to the clinic or come to the hospitals with this, and we give them phosphate, or we actually suggest them that they eat a bone broth. So if you actually want to go on a long diet with water, firstly, I would not suggest that. But if you still insist on going on a long crash diet, then make sure you take your vitamins before you actually start your diet, and you actually eat bone broth within those fasting periods, so you're getting those micronutrients, those electrolytes, those vitamins. So the fifth thing is you're actually eating too many meals. If you eat more meals, you are actually preparing your body for getting hungry all the time. Now these kids, they're hungry all the time because they eat all the time. They're snacking a lot, and because they eat a lot of sugar. So if you're snacking all the time, you're having 5 or 6 meals a day, you're getting those little spikes in your blood sugar. Those are not good for you. Those will release insulin, they will inhibit glucagon, and they will inhibit the fat burning process. You'll feel hungry a lot, and you will actually end up eating more frequently than you actually planned. And if you would skip a meal, you would actually feel a lot more crappy than if you would skip a meal otherwise. So number 6 is you want quick results. Now, fat loss does not happen overnight, and whatever fat loss happens overnight is not good. Whether it's liposuction, whether it's removal of fats from a surgery or some burns or something like that, or whether it's due to an infection or due to anorexia, it's not good. Because if you suddenly lose a lot of fat, your body will actually get into a haphazard condition. It would have a difficult time fighting these microbes. There would be damage to your immune system. There can be damage to your cardiovascular system as well, because if these essential fatty acids and these medium chain fatty acids, they go down, your heart would get affected. You would actually lose a lot of fluid. You would lose a lot of those electrolytes. You can end up fainting. You can end up even going into a coma, or you can end up harming yourself seriously. We have met a lot of bodybuilders that actually took diuretics before they went onto the stage just to look better, and they did serious harm to their kidneys and to their vascular system. So number 7 on the list is using laxatives. Laxatives are these substances like sugar alcohols and many other substances that make you go to the washroom a lot. You actually end up defecating a lot, and that too in this liquid form of undigested meat. So taking these laxatives can get you into a hypotensive state. You can go into a shock, you can faint, and you can seriously damage your health. As a safe alternative to laxatives, I would actually suggest appetite suppressants. Appetite suppressants are a great substitute for people who actually want to use something for their weight loss, apart from the natural diet. Now, appetite suppressants include black coffee. Black coffee is a great appetite suppressant. Number 2 on the list is peppermint gum. Now, if you eat peppermint gum or you chew it, because of the high mint content, it would actually suppress your appetite. People also use mint flowers or other flavored chewing gums as an appetite suppressant. Black tea is also a good appetite suppressant. Number 8 on the list is taking medicines for losing weight. Now, if the doctor finds out that you are actually morbidly obese, or these medicines have more benefit for you than harm, he may prescribe you medication to lose weight, or you self-medicate to lose weight, and you take medicines like orlistat or amphetamine derivatives or any other drugs to lose weight like topiramate or stuff like that. You are actually putting yourself into serious harm. These amphetamines, they can cause heart attacks, stroke. Amphetamines can also increase your resting pulse rate. It can also increase your blood pressure. They can keep you awake. They can give you insomnia. Orlistat, it can actually cause steatorrhea. Now, steatorrhea is a fat malabsorption syndrome in which you actually are not absorbing fat from your intestine, and due to that, you are actually also not absorbing fat-soluble vitamins like vitamin A, vitamin D, vitamin E, vitamin K. If you do not get vitamin K, you'll bleed. You will have internal bleeding. If you do not have vitamin A, you'll have night blindness. And there are many other harms that comes with taking these medications. And the other is topiramate. Now, topiramate is actually given to people with focal seizures. And if you actually take these supplements, you actually take topiramate for the side effect that it has, and that is weight loss. Once you get off topiramate, you would actually start having seizures. This is really harmful. So do not take any unprescribed medication. But if the doctor has prescribed any of these medications to you, he may have balanced out the harms and the benefits. He may have found out that the benefits are greater for you than the harms. Number 9 is not going to a doctor if you have recently gained weight. If you have recently gained weight, it could actually be many other factors than just eating more. You could actually have hypothyroidism, where your body is not making enough thyroid hormone, where your basal metabolism is actually really low. It could also be eating disorders that may be due to some emotional stress or something that you are feeling. So going to a doctor or going to a psychiatrist who would help you with these eating disorders or with hypothyroidism or any other medical condition that could cause weight gain, he would actually help you. So some people that get prescribed on antidepressant like Prozac or many other antidepressant, tricyclic or any other, they actually gain a lot of weight. Now that is a side effect of some medication. If you are gaining a lot of weight and you find that it may hinder your normal body functioning or it is really dangerous for you, you may go to the doctor and tell him to change your medication. Number 10, and the most important point on the list, is trying to achieve that ideal weight. The weight that society wants you to get in, or the weight that everyone wants you to get in. Well, guess what? You should set goals for yourself, and no one else should be setting goals for you. If you think you are happy as a 100 kg male, well, that's good for you. If you think you're happy as a 70 kg person, that's good for you. Until or unless it is not harmful for your health, until or unless it is not causing you chronic illnesses or not causing you hypertension, type 2 diabetes, pre-diabetes, conditions like that, whatever weight you are in is actually okay, or whatever you feel comfortable with is okay. So trying to achieve these standards set by these Victoria's Secret models or these Calvin Klein male models, that's not achievable and not as well healthy. I've seen that most of these models, when they do not eat appropriately, they go into depression. And these males that actually look really good on the magazine covers have a lot of hormonal issues like low testosterone and low libido. Same comes with the females. So getting an ideal weight that you have set for yourself is okay, but something that society dictates you or something that the media shows you is healthy, well, actually it turns out it's not that healthy. It comes with a lot of side effects. So you should set goals for yourself and achieve them only for you and your happiness alone. Thank you so much for watching the video. If you like the video, drop a thumbs up and comment down below whatever you'd like me to make a video about next. Or any queries that you have, you may drop them in the comments. Make sure you subscribe to the channel and press the bell icon so that you do not miss the future videos that are coming on many important topics.